Hello, thank you for joining us today to review the University Health Transplant Institute Adult Kidney Transplant Program Strategic and Marketing Plan for 2026 to 2029. As part of our executive summary, University Health Transplant Institute is a service line under University Health. We have been performing transplants for more than 55 years in San Antonio, and we outreach into areas of Corpus Christi, Laredo, and El Paso, Texas. We're dedicated to patient safety, living organ donation, and organ utilization, which have led to superior patient outcomes. And the national call to action is to increase access to kidney transplant. Our mission at UHTI is to expand access to kidney transplant and close the gap in organ transplantation through living organ donation and DCD organ utilization. These efforts are to increase kidney transplant volume and promote equity in access. The patient care delivery model for our institute is a combination of the primary nurse care model and the case management model within the ambulatory care setting. We have an ambulatory referral mechanism for our specialty of organ transplant and have our own transplant clinic for pre and post-transplant patients. Our Transplant Institute is committed to increasing our referral and transplant volumes in alignment with the Increased Organ Transplant Access, or IOTA model. The objective of our first strategic goal is to expand the number of transplants performed annually at our institute. Our goal is to achieve a 10% increase in transplant volume each year through the 2026 to 2029 strategic plan year. Our second strategic goal is to strengthen the criteria and processes for accepting donor organs. Our performance metric for this strategic goal is to increase DCD organ transplants by 10% year over year, as well as 5% in living donor kidney transplants year over year during the strategic plan period. The objective of our third strategic goal is to enhance the long-term survival outcomes for both patients and transplant grafts over a 5-year post-transplant period. Our performance metric for this strategic goal will be that UHTI will meet or exceed expected and observed survival measurements as reported annually by the Scientific Registry of Transplant Recipients, or SRTR, from 2026 through 2029. The SWOT analysis performed by the team, here demonstrated on this slide, shows our strengths, weaknesses, and opportunities and threats, which we will review as part of our market analysis in this presentation. So our external market analysis is on this slide. University Health Transplant Institute is based in San Antonio, Texas, and is one of 2 adult kidney transplant centers in the city. Methodist Specialty and Transplant Hospital is actually right next door. UHTI competes both locally and regionally in our outreach areas, including Las Palmas Transplant Center in El Paso and Houston Methodist Transplant, which is very present in the Corpus Christi and Laredo markets. UHTI has already collaborated with University Medical Center in El Paso to streamline our patient evaluations and strengthen our regional presence there. We are a center of excellence, as noted by Optum Network, an elite Interlink member, and as well hold the Blue Distinction designation provided by Blue Cross and Blue Shield. When looking at our internal market analysis, we consider the IOTA model domains of achievement, performance, and quality. UHTI already has a robust organ acceptance practice along with excellent 1-year patient and graft survivals based on the SRTR. This performance, along with our perfusion technology program, ensures a safe and high-quality patient care, along with increased access to transplant for our patient population. Our program currently has a strong presence in place with the end-stage renal disease and chronic kidney disease provider community, and has been working towards increasing our presence on a patient-facing basis outside of our clinic setting. Our goal is to solidify this presence with consistency to foster relationship building with our referring providers and our patients and potential patients. Our marketing strategy will focus on visibility and outreach, engagement events, and education and collaboration. For visibility and outreach, we have a strong social media presence and external marketing, billboards and airport ads in collaboration with our corporate communications. This is supported by both corporate communications and our transplant outreach and business development. We currently hold engagement events like lunch and learns with our social workers and physician clinics, as well as symposiums for our social workers. This is to educate and connect with dialysis units. Education and collaboration includes symposiums to inform the social work community about transplant processes, improving waitlist additions, and transplant outcomes. And transplant nephrologists partner with internal medicine and other service lines to enhance referrals and consultation practices for inpatient candidates. When looking at our implementation plan for these marketing strategies, we're seeking to see more collaborative year-round marketing and outreach with ongoing team-driven efforts to maintain engagement and not just one-time events. We really want to see strategic follow-up at regular intervals to reinforce this outreach. We seek physician engagement with quarterly physician-to-physician communications, plus the ad hoc discussions as needed. Our events and activities we are looking at are the Lunch and Learn sessions, clinic visits, and social work symposiums hosted and coordinated by the Transplant Outreach and Business Development team. Our dialysis unit lobby days are scheduled at least 3 times a week, aligned with clinic schedules for patient outreach. Social work symposiums held locally and in outreach areas at least 4 times a year. And those social workers within the dialysis clinics have the greatest exposure to our patient population. So our goal is to provide our available resources to these social workers and referring physicians to form a true business relationship so they have trust in our institute when referring patients to our center. Key participants are transplant social workers, our nephrologists, surgeons, clinical liaison, patient relationship specialists, our nurse coordinators, the assistant director of the program, and of course the medical director. Internal marketing looks at managed by the medical director and assistant director of the adult kidney transplant program to really seek those internal opportunities for referral to transplant. So in reviewing our risk assessment and of course mitigation, we look at referral patterns. And despite our superior outcomes and high demand for transplant, our referrals are often shaped by long-standing relationships and local politics. We see these challenges along the competitive landscape are really just having to build those relationships with those referring providers. Internally, of course, with the public health system infrastructure, we limit our evaluation efficiency. We have some referral and evaluation backlogs just due to delays and slower waitlist additions compared to our competitors. Our rival centers expedite candidate evaluations and use broader criteria, which lead to more living donor transplants. Another challenge we seek is currently the government has no plan to renew the ACA subsidies, and certain ACA plans will no longer be available in Texas beginning in 2026. This increase in insurance premium costs for the consumer will prevent significant challenges for our patients accessing care. So here we have our budget overview looking at our projected revenue for all 3 years, looking at facility fees, professional fees, and of course the potential for the IOTA incentive. This financial assumption is not just about revenue. It demonstrates how UHTI's strategic goals, increasing transplant volume, enhancing organ acceptance, and optimizing survival, are expected to translate into measurable financial sustainability. The projections also set the baseline for subsequent years, where transplant volume and revenue are expected to grow by 10% annually. We feel that this strategic and marketing plan presentation really outlines a clear financial trajectory for UHTI, which is driven by targeted increases in referral volumes, which translates into increased transplant procedures. Of course, we're looking at that 10% year-over-year increase in transplant volume, which then correlates with this projected revenue. Considering our marketing initiatives, we're looking at a proposal for, of course, additional FTEs to support these initiatives and the anticipated growth from our outreach efforts. To support the outreach efforts, we're looking at a budget adjustment to support the additional events we seek to support within the community, such as the symposiums and the lunch and learns. So we've made our recommendations here. In summary, through our initiatives, we do seek to expand access to kidney transplant for our patient population, close that gap in organ transplantation through innovation, and increase transplant volume and promote equity in access. We thank you for your time and are open to any questions you might have.